Organizations like the Drudge Report are posting that they believe this could go past Thanksgiving. What's the implication of that?
Well, look, I hope this shutdown doesn't go beyond Thanksgiving because that's going to mean Republican cause hurt and pain on families across this country. The fact of the matter is, they control the House, the Senate, the White House. All they have to do is simple: do something we've done across our history, which is come to the table and negotiate with Democrats on how to solve a healthcare crisis that doesn't just exist here in Rhode Island. It isn't just a blue state problem. In fact, most of the people seeing an enhanced premium tax credit from the Affordable Care Act are in the red states.
Hey, and we are the Coalition, loud and proud, civilly disobedient media. We are broadcasting live, well, at your Rhode Island Community Food Bank, an amazing organization that delivers tons and tons of food across the state at a level of efficiency that even folks like me from the dreaded private sector have to admire. We're here, of course, with Congressman Gabe Amo. He was here today speaking with management from the Rhode Island Community Food Bank about the challenges faced on an ongoing basis with hunger in the state, and additionally, of course, focusing on the impact both on agencies like this as well as healthcare as a result of the government shutdown. Congressman Amo, we've had numerous opportunities to talk about, the dire implications in terms of pricing for healthcare plans. But let's start, in a sense, from the beginning. Where are we right now with regard to the shutdown, from your perspective?
Well, look, we are not seeing a resolution in sight to the shutdown, and that's because Donald Trump wants a shutdown. That's because my Republican colleagues in the House and in the Senate have abdicated their Article 1 responsibilities, where Congress should be at the table, should be working collaboratively. Republicans control the White House, they control the Senate, they control the House. They have the burden of getting this government open. They also have a twin burden of resolving the healthcare crisis that they've created. Instead, they've made a choice. They said, we'd rather have a shutdown than solve the healthcare crisis in America. That healthcare crisis is manifesting itself right now in mailboxes across Rhode Island, where we have people receiving letters showing their premiums for the Health Source Rhode Island marketplace skyrocketing. 40,000 Rhode Islanders, many of them 13,000 or more, will opt out according to Health Source Rhode Island. That creates a real big strain on our healthcare system in Rhode Island. That's coupled with the big ugly law and all of the dastardly cuts there, from $300 billion to snap $1 trillion out of our healthcare system. And so ultimately, this healthcare crisis is now married by a shutdown crisis that is going to inflict real harm on people's lives. And that's why I'm here at the Community Food Bank today, because of the dueling crises. The administration has said that they don't think they will pay out, that they will not pay out SNAP benefits for November 1. That is going to create a crunch on agencies like the Rhode Island Food Bank, like many of our churches and food pantries, community action agencies who fill in gaps. Those gaps are going to grow larger, and that's because Republicans are continuing this shutdown.
I can tell you that our sister organization, Libertarian Mutual Aid, is already seeing a crunch at local agencies. It's really, to use a cliche, it is really the perfect storm, because a number of these agencies are in a situation where they're actually going through construction and upgrading their facilities in anticipation of a difficult winter. You've got facilities that are temporarily offline. You've got a handful of facilities that are being built. You've got responses from churches in this state, independents of the state, which are in the process of being established. But right now, the notion that SNAP and those foods would just disappear as if it was a bad magic trick it is potentially horrific. What's in terms of the federal government looking at it from a financial perspective? I don't know if OMB or organizations like this are actually even able to be open right now to chart these situations. Organizations like the Drudge Report are posting that they believe this could go past Thanksgiving. What's the implication of that?
Well, look, I hope this shutdown doesn't go beyond Thanksgiving, because that's going to mean Republican cause hurt and pain on families across this country. The fact of the matter is, they control the House, the Senate, the White House. All they have to do is simple. Do something we've done across our history, which is come to the table and negotiate with Democrats on how to solve a healthcare crisis that doesn't just exist here in Rhode Island. It isn't just a blue state problem. In fact, most of the people seeing an enhanced premium tax credit from the Affordable Care Act are in the red states. And so this is common sense. I think it is cruel, because you will also see federal employees across the board, from people working at our veterans assistance offices to Social Security call centers to the IRS and the SBA, a whole range, including our air traffic controllers, our TSA agents, not getting paid. And so they can stop this, but it requires them to demonstrate a commitment to working on behalf of all Americans, all Rhode Islanders, and negotiating on the basis of reducing the impact of their healthcare crisis. And we can do it.
Is there any appetite at all, and I'm not arguing that simply cutting off salaries is the way to do it, but is there any appetite at all from the Democratic side of the House to cutting the size of government? A significant contention around the bloc that helped elect Donald Trump is that there's simply too much fat and there's too much waste. Now, of course, what you see right now is direct impact on those public-facing employees of the government. But is there any appetite for downsizing government at any level?
Well, look, the premise that Donald Trump sets forward is that he's going to cut Democrat programs, as if there is such a thing as a Democrat program. The programs don't have partisan affiliations, and so if there's a good faith conversation about how we should be spending our federal dollars, like that's a reasonable conversation, but not when the premise is there are programs that belong to one party, not when the premise is I'm going to cut health care for the most vulnerable, not when the premise is slashing Medicaid, slashing SNAP, making it harder for people to get college educations, and so on and so forth. So their campaign of cost cutting is around cruelty and not around competence. And that is, frankly, a distinction that we have to make, because it is essential that we take care of people in our communities. People should not go hungry, should not go without care. Dr. King talks about of all the injustices that inadequate health care is amongst the most immoral. Let us follow those words. Let us act in accordance with them and solve the Republican healthcare crisis.
Congressman Amo, thank you very much for your time as always.
Thanks for having me.